Good afternoon. We are just going to wait for some few people to join in before we start at 1 o'clock. It is 1 o'clock. Good afternoon. I am Dr. Shazia Mungly and I am a specialist psychiatrist in Cape Town. Grab your lunch and today in this 10-minute video, I will guide you through depression and anxiety, how to recognize your symptoms, how to seek help, and also coping strategies for yourself and your family for depression and anxiety. I will start with it is okay to feel sad on a Monday morning. It is okay to feel grumpy when we didn't have lunch yet. However, when we talk of depression, it is beyond that feeling of one day of sadness. It is a mood disorder which is characterized by a sustained low mood for at least 2 weeks with associated symptoms of not enjoying the things that you usually enjoy, feeling of tiredness, finding it difficult to get up in the morning, low energy, difficulty concentrating. You also notice like a changes in your appetite. Either you're eating too much or too little with associated weight gain or weight loss. Having trouble sleeping, either sleeping more than usual or sleeping less than usual. Also feeling of guilt and worthlessness and also dark thoughts, sometimes suicidal thoughts. And when the symptoms that are described are present and it interferes with your social and occupational functioning, it actually becomes an illness and can significantly impact on your health. Remember, depression can affect anyone. It is one of the most common mental illnesses which can affect 1 in 10 people at some point in time. So, a lot of people will say, what are the causes? Why me? The causes of depression are actually multifactorial. So, there's not a single cause for depression. Research will found that there are changes in your brain system, changes in the neurotransmitters, but depression can occur as a result of a stressful life event. For example, losing a job, financial stresses, especially during COVID-19 as well, a breakdown of a relationship. People with a family history of depression also are at increased risk of developing depression, but there's no single gene which is associated with depression. Women in particular are also vulnerable to depression, especially at certain times of their life, for example, in relation to childbirth. Previous significant trauma like abuse during childhood, certain medical conditions. So when we have depression, we have to exclude medical conditions, and certain medications that you're on can also cause depression. So as you can see, there's a lot of factors that can cause depression. And major depression also can coexist with anxiety disorders at least 60% of the time. So we need to talk about anxiety as well. With depression, you can also feel anxious, and there's a subtype which we call major depression with anxious distress. So if we speak a little bit about anxiety, it is normal to feel anxious. It is normal to feel anxious for an exam. It is normal to feel anxious for your first Facebook live video. And it's okay to feel anxious when you have a dangerous situation. You need to. So when you have a stressful situation, your body releases adrenaline and you need it because that is the fight and flight response. So it's totally normal. But anxiety becomes abnormal if it is out of proportion to your stressful situation, if it persists after the stressful situation has gone, or it appears for no apparent reason when there's actually no stressful situation. And people with anxiety, if we speak a little bit about anxiety, people with anxiety develop feelings of worry. They fear the worst, they feel tense, they feel irritable, they have difficulty concentrating, sleeping, and also physical symptoms. A lot of them have like that muscle tension on their shoulders and on their neck. So, as with any mental illness, if first symptoms are present and interferes with your social and occupational functioning, meaning at work and at home, you need to consult a mental health care professional. Because we are in the COVID 19 and pandemic, I would want to just speak a little bit about COVID 19 and mental health. There is increasing symptoms of depression and anxiety, especially during COVID 19. We have found an increased number of calls to the South African Depression and Anxiety Group, and there are multifactorial causes. So there are like financial stresses, loss of employment. A lot of people have been feeling socially isolated. Healthcare workers are also at increased risk of depression and anxiety. Other causes, people have lost their loved ones and have been unable to find closure, especially during COVID 19. So, I've spoken a lot about depression and anxiety, and now let's look at the tips on how to cope with depression and anxiety. Recognize. I've described the symptoms. Recognize your own emotions when you're feeling anxious or down. Be able to seek help. And if you ever feel suicidal, go to your nearest emergency center or the helplines which I've included in the comment section. First thing with depression and anxiety, lifestyle changes. Eat healthy diets. I hope you're having a healthy diet during this lunchtime. Avoid the use of substances to cope with depression and anxiety, and also caffeine when you have an anxiety disorder. Reduce the intake of caffeine. Regular exercise is also important. Exercise release your endorphins, which are your good hormones. However, with someone who have depression, it is difficult to just say, go and exercise. So what we'll do is grade it. If you can do 10 minutes, that's fine. Next time you're going to do 20 minutes. And all those changes actually uplift your mood. Talk to people you can trust, social connection. A lot of people will say, getting it off my chest helps to relieve some pressure. Make an effort to stay connected to the people you care about, because then you do feel less socially isolated. Because what can happen is depression can become a cycle. You become depressed and then you feel depressed about being depressed. Remember, it is a real illness, so it is not your fault. Keep yourself occupied with the things that you usually enjoy. For example, music, sports. Do something that keep your mind off that depressive thoughts. Other techniques you will learn, and I've included it as well. You will learn it with your therapies, and I've given you resources with that. Is breathing exercises. Learn how to breathe. It's often forgotten when you're anxious. And as you breathe in and out, deeply and slowly, as you breathe out, just try and get out all of those worries. Mindfulness help you to get in that present moment. I've also included mindfulness app. Progressive muscle relaxation. So when you feel anxious, your muscles are tense. So in progressive muscle relaxation, you actually learn how to tense and relax those muscles, and it makes a big difference when your muscles are relaxed. The other technique is distraction techniques. So when you feel anxious, try and think of a nice image like the beach, or try to repeat alphabets backwards. Remember, our thoughts are linked with our emotions. Learn to challenge any negative thought into a more positive thought. For example, if we have a project, rather than saying it is never going to end, we rather say we actually have started it. So it is good. It's a good start. And focus on the things that you can control. Now I'll speak about depression anxiety for families. So one of the best way as a family member to help someone is to listen to them. Just remind those people that you do care about them. Take time, speak to them. It helps them to keep off their mind off with depressive symptoms. They can become irritable, so try and be patient. And if someone you care is depressed and you think that they need help, please bring them. Please encourage them to seek help. And if ever they feel suicidal, you need to get help for them. And telling someone with depression, snap out of it, or pull yourself together is only going to make things worse. For example, you don't tell someone who just had a surgery, day one of surgery, get out of bed. You'll never do that. It's the same for depression and anxiety. Also, as a family member, look after yourself. If someone close to you is depressed, it can actually also be hard on you. So the same tips apply to you as a family member. Just like I wanted to just talk a little bit about treatment. So when you seek a mental health care professional, if you experience those symptoms I described and you have to seek help with a mental health care professional, so for mild symptoms of depression and anxiety, it is usually treated with psychotherapy, which we also say talking therapy. But for most severe symptoms like severe depression and anxiety, we use a combination of medications and psychotherapy. Remember, every individual is unique, and if medications are usually prescribed, it is tailored according to your individual needs. There is use of different drugs at different dosages, which will be discussed with your mental health care professional. Remember, treatment can take a few weeks to work, so try to be patient and allow enough time for it to have an effect. It is actually a journey with your mental health care professional. In conclusion, I hope this 10-minute talk has given you an outline of depression and anxiety and also reduced the stigma associated with any mental illness. For families also to have an understanding of depression and anxiety and be in control of your mental health as you will with your physical health, and to seek help when needed. I would like to thank you, the audience, for listening for this 10-minute video, to Cape August for hosting me, and also to Rihanna and Ati for being patient to guide me through this Facebook Live video. I will just look at some of the comments here. Said thanks Cape August for equipping us with knowledge, and we support mental health awareness. And you're not alone. Yes, you're not alone. We do have support groups and I've included it in my resources. And take good care of your mental health. Yes, you need to take good care of your mental health as you will with your physical health. I have also included the suicide crisis line and also South African depression and anxiety, which is a support group. And thank you. If you have any more questions and comments, I will look at it. Thank you very much for tuning in.